continuing to look at historical methods as described by early osteopathic writers. Here we're looking at some cervical methods or some neck methods from McConnell. So we have one portion that has already shown up from another writer. One of the things he talks about is standing at one side of the patient, using their one hand on the forehead and the other hand on the tissues on the other side of the neck. In other words, what you're going to do is you're going to work on the cervical tissues, right? So he doesn't describe this particularly accurately, but you can assume based on seeing this in other writers, including Hazard, is that you're working essentially anterior to the SCM, so on the lateral tissues, the anterior to the SCM, all the way back to the SPs on the side, on the opposite side, right? So you put the heel of the hand essentially on the SCM, the fingers at the SPs or the spinous processes, and then you just close your hand like this, so you come away from the SPs and you essentially constrict or grab everything that's on that side, right? So he says one hand is moving the head, one hand is moving those soft tissues, right? So it can look like this. So short lever, long lever, and mixed leverage on some level, right? So that's one of the things that he talks about. He talks about standing at the head of the patient with two hands and creating rotary motions where one hand is moving the head and the other hand is working on the soft tissues on its side. So that can look something like this. So the head is between the hands and the fingers are reaching down. The fingers, because they'll be angled, will essentially run into the spinous processes on either side. So either hand can do this, and because it's angled, you're holding a lot of the neck. So essentially what he's saying is as you turn the head, what you would do is work the SPs, work the soft tissues on that side. So as you turn, you can basically pull through the soft tissues away from the SPs. Right, now you can do this on either side. So as I turn the head to the right, the tissues on the right side may be getting softer, and I can work perpendicular to fiber direction on those by pulling from the SPs to the side. I can do that on this side, or the side that's being exposed and essentially lengthened, I can also pull on that. So basically it just looks like curling the fingers a little bit like this. Then you can do it on either side. All right, but basically as you turn the head, you pull the tissues, and you can do that either on the side you're turning to or the opposite side. He doesn't necessarily specify that. He does specify that you would be working on the soft tissues with the hand on one side as the other hand controls, right? So he does talk about holding the hand in between the head. So that is most likely the method, or what the method would look like. It could have looked a different way, but there's no picture evidence to suggest it looked a different way. The final one that he talks about is essentially using exaggeration, primarily on extension lesions. So what you would be thinking about is something that bent backwards, right? So he talks about exaggerating by hyperextending the head, followed by grabbing a transverse process, then taking the head forwards with some traction and rotation, and essentially he says pulling down, but there's no place where you would absolutely be able to pull down and do this unless you had your thumb on the back of the neck, which he doesn't specify, right? So you could be holding like this, right, and pulling on on a transverse process like that, or you could be fulcruming underneath the head and grabbing it with your thumb. He says fingers, so that would intone, it's more likely like this based on the description, but it may not be. It's quite awkward to work like this, but he talks about basically creating hyperextension. So you've got your fulcrum on whatever vertebrae you believe the lesion's on, you create the hyperextension, that's the exaggeration, then you have to somehow manage to find the transverse process of that vertebrae, which I don't think you're going to do in this case, depending on the size of your hand, right? So a little bit more likely, what's more likely is to have a hold like this, where the index finger is essentially the fulcrum, right? So you put the index finger on the vertebrae you're interested in, you create the hyperextension, you can find that transverse process. Maybe I don't actually agree that you'd find it accurately because there's just so much tissue here, but then he says you take it forwards, you create some traction, right? So the traction is created by all this contact with the head and just leaning back, but not letting your body come away from your hands. You basically keep your hands in the same position with respect to your body, and then you can create your traction just by leaning back. So if you watch his chin, right? His chin in relation to his chest, you'll see a little bit of traction there. So it's exaggerate, right? Then you pinch more or less with your finger. You're probably going to miss the actual transverse process, but because your thumb is going down the neck, you're accidentally going to grab it if you can get close to it. And then you create your traction with your rotation. So the exaggeration portion, taking it the way it likes to go, he says essentially you're trying to extend it more, then you bring it forwards. In bringing it forwards or tipping the chin forwards, you're creating flexion, and that should basically put pressure from the vertebrae above and below to slide it back, as he's essentially attempting to suggest. And then you've got the thumb bar grabbing the lateral portion to maybe create some inferior motion. So essentially a glide on one side, but a glide on one side is a rotation in this case. So it won't work exactly the way he's describing it, but what it would look like: extend, flex, traction, rotation is essentially what he's talking about for dealing with an extended portion of the neck in whatever way you find that.